motion, and lift up and down, doing concentric and eccentric motions back and forth, or hold it in that position. Then you would progress into standing hip flexion with a band. Oh, excuse me. You would progress into unweighted good mornings. So good mornings would be super helpful with this, but you would want to do them unweighted because you don't want to be putting all the extra weight. Good mornings can be very hard workouts, especially if you're using a barbell. Moving on here to ACL, here we go, anterior cruciate ligament tear anatomy, also known as ACL. So the affected ligament is the anterior cruciate ligament, which, as you can see in the photo, is directly in the center and is anterior to the posterior cruciate ligament, hence the name. But it's one of the most common injuries in sports in general. Grade 1, it's a little bit different. Grade 1, because we're talking about a tear here, grade 1 it would just be mild damage done to the stretching of the ACL, so that wouldn't necessarily be considered an ACL tear. Grade 2 would be stretching of the ACL, which results in a partial tear, which is actually somewhat unlikely. Usually when people tear their ACL, it's grade 3, which is a complete tear. Now the mechanism of injury for the ACL tear, it's generally hyperextension and internal rotation of the tibia or femur when the foot is planted. So MOI 1, I listed quick movement to keep control of the soccer ball, resulting in the foot staying planted in the ground while the femur immediately rotates. So if the leg is in the ground, the femur is immediately rotating towards the body, but the foot is staying planted, and this results in, if this is a knee joint, twisting and separation, tearing of the ACL joint, and you can see why most common ACL injuries will be complete tears. And the MOI2 would be the athlete try to turn the body 180 degrees, a quick turn, and as the ball flew over the athlete's head, this resulted in a quick turn and twisting of all the body except one of the feet that were planted. Sometimes athletes will take pressure off their foot, but it'll stay stuck in the grass or stuck on the basketball court, whatever it is. So now we're moving on to the assessment and treatment of ACL tears, and these are actually going to be similar to sprained ankle. You want to do the anterior drawer test, and you want to keep the knee at a 90-degree angle, as you can see on the table, and then you're going to place your hand directly below the knee and push forward. And once again, if you're hearing the clicking or if it's extending too far forward or causing pain for the athlete that you're working with, generally there's something that happens to the knee joint. And you also want to stabilize the top of the leg, and that can be an indication that there is an ACL damage and potentially an ACL tear. And then the lever sign test, the patient lays completely flat. You put your fist up under the upper third of the lower leg, and you hold down the quadricep closer to the knee. And so if the ACL is intact, the heel will actually raise off the examination table, and the test is positive if the heel stays on the examination table, which indicates that the ACL has been torn because it's therefore not connected. So once you're doing the upward motion on the lower leg, downward motion on the upper leg, there's no ACL to connect it to pull the heel up with the foot, which is actually pretty fascinating. And what I did for treatment was rehabilitation, in parentheses grade 2, because if it's a grade 3 sprain, that could be a whole other severe treatment. But rehabilitation for grade 2, you can also do surgery for grade 2. It's up to the physician who's diagnosing the patient and how severe the grade 2 strain is. And also it comes down to what sport they're going back to. If you're going back to a sport that's going to be putting a ton of impact on your knee, you might want to assess it and potentially get surgery. So ACL tear preventative exercises, weighted lunges, 5 sets, 5 reps, 2 times per week, and then progressing into single leg deadlift, doing back squats, 5 sets, 4 reps, 2 times a week, progressing into box jumps. Box jumps can be kind of dangerous. I'd recommend doing something around a foot, maybe a little bit higher. It's preventative, so you can go with these exercises that are a little more extreme, but I'm not a huge fan of box jumps, but I think for something like this, if they're low enough, I think they're good. And then rehab exercises for the ACL tear. We do prone knee flexion, so we'll be doing knee flexion while we're on the ground. That's as simple as just bending the foot up towards the body. 2 sets, 10 reps, 8 times per week, and then progressing into half squats, which is a squat. You're going halfway down, so you're not putting as much pressure on the knee. Then we do heel slides, where you lay down flat, your heel's on the floor, like this, and then your heel goes flat, and you slide it up towards your gluteus maximus, back down, and then you would continue that motion over and over again. Well, not over and over again. You do 8 repetitions, 2 sets. And then you'd progress into heel raises, so calf raises. These would be stabilized because it's rehab, so you want to be holding yourself up. And here are my references, mostly using the textbook. And that completes my CAP Kinesiology 353 assignment. And thanks for a good semester, and I appreciate it. Hit the 20-minute mark. Was trying to do less than that, but it's all good.